Hello and welcome to Psyched, the show where we explore psychedelics through social, economic, and political perspectives. Let's introduce our next speaker. Next up, we have Hannah McLane. Hannah McLane is a physician, psychotherapist, entrepreneur, and nonprofit founder. She holds degrees from McGill University, Temple University, Brown University, and Harvard School of Public Health. Her residency experiences include neurology and occupational and environmental medicine. Her post-residency training includes postdoc fellowship in patient safety, psychoanalytic training, and MDMA-Assisted Psychotherapy training through the MAPS program. In 2010, she founded the SoundMind Project, which is a global organization aimed at providing alternative therapies for neurologic and mental health disorders. The SoundMind Center, a psychedelic therapy center in West Philadelphia, will also be a collaborative think tank space aimed at re-envisioning what medicine could be. It is opening in summer of 2020. She conducts research at the VA Medical Center in Philadelphia, which focuses on cognitive diversity, PTSD, ketamine-assisted psychotherapy, and emerging alternative therapies for mental health issues. She is one of only a few dozen physicians in the United States training with MAPS to be an MDMA-assisted psychotherapy provider in their expanded access program. Hannah, thank you so much for joining us and welcome to Psyched.
Thanks, Merrick. It's great to be here. Let's see, so I have, I guess I wanted to talk a little bit more about our project, SoundMind Project. And I also, I'll be sharing the screen for just a bit of this, but mostly just my face the whole time. Today I want to talk about psychedelics and intuition. It's something that I'm very passionate about. Also something I sort of threw together in the last week, just to bring up a new conversation that I haven't really had with many people. But first, just a little bit more about my organization and what I do. So I'm a physician in neurology and preventive medicine, and the founder and director of SoundMind Project. So SoundMind Project is a nonprofit we have had going since 2010. And SoundMind Center is our psychedelic-assisted psychotherapy center. We're opening it in 3 months in West Philadelphia. So we will be offering ketamine-assisted therapy and MDMA when it's approved, hopefully in 2022. And we have 8 clinicians training with the expanded access program with MAPS. So either expanded access or post-approval. We're really excited about that. And our clinic also has 6 clinical rooms with 3 Airbnbs, so we'll be able to have people stay overnight, which we're also really excited about after their treatment sessions. And we also hope to be a community space and training center for future clinicians. So we also have a 9-week intro to psychedelic therapies class coming up that we're doing online that will start in August or September. So you can find that info on our website. And 2 other folks from SoundMind have spoken already at Psyched 2020, Steffian and Margaret Fleming, who are both working with us, and they're amazing. So I'd encourage you to check out their talks. And lastly, I'm a part of the first cohort of the Tabula Rasa incubator, which is very exciting too. The product I'm developing under Spindle Medical Incorporated is an immersive technology product for psychedelic journeys. So stay tuned for that in the future. So basically my interest in psychedelics and intuition came up. I've done a lot of talks about ethics and inclusion, and our nonprofit is very much focused on creating inclusive, being inclusive for marginalized populations. I wanted to go into a different area right now. I think this is important with all of the upheaval that's happening with COVID and racial disparities. There's a difficulty that we're all having, I think, figuring out how to best use our energy and use our intuition to tell us, you know, how to move forward, what we need to change in our lives, maybe using this time to sort of reorient. So as a neurologist and psychoanalyst, my friend essentially asked me, what do you think that psychedelics do? This happened a couple weeks ago. What do psychedelics do that other medicines don't? And I thought about that, and what immediately came to mind was the concept of amplifying intuition. And then he said, well, what does that mean? And I think in a lot of ways we have this sense that there's aspects of our life that are intuitive, then they feel ephemeral and hard to grasp. And then psychedelics can bring that out somehow into the surface and make them even more apparent. So it's a way to connect with our own personal truth. So what I wanted to do is start with this idea of functional neurologic illness. And it's something I've been fascinated by since my neurology residency at Penn. And I also wanted to show a video about this. So for anyone who doesn't know, functional neurologic illness, it's basically, it goes by a lot of names: functional illness, conversion disorder. Way back in the day, it was called hysteria. And it's basically when someone comes into way you can actually cure the illness is to delve into their underlying trauma and help them and it's what's most fascinating about these illnesses is that the person coming in is sure that it's physical. And so once in a while, maybe 1 in 100 people that come in with this, it's called malingering, and they're actually aware of it and doing it on purpose and sort of faking for maybe financial gain or something else. Most people that come in, they honest and truly don't know how to fix their problem. So I'd like to share my screen and show you guys a clip of this. See if this works. All right, can you guys see that?
Yep, you're good.
Sweet. Okay, so this is, I picked, there's actually a article that if anyone's interested, it's called Functional Neurologic Disease or Disorders here. So you can look up, there's lots of videos on what these things look like. But this is one I thought that would be interesting because it's, I think for a non-neurologist, you can sort of tell that the tremor is a certain way. And then when they ask him to do something else with his hand, the other hand is unable to do both of the things at the same time. Let's see if we can get this.
Mm-hmm. 86, 79, 72.
Okay, cool. Sorry that was so loud. So this is the article that I can share with y'all if you want to see it. And then in a little bit, I'm going to talk about expectancy. So there's another article that I'll also share with the group in whatever way I can. So I'm just going to exit my share and go back to my face. Okay, cool. So let's see. So that's functional neurologic disease. And so the question I have is how many, what ways do we have something that we are, there is some way we can volitionally control it, or something that feels like very confusing, that it's not something we're doing, but with the right conditions, we can bring out the full picture of what's really going on. So I'm proposing that we all have mini versions of functional illness in our life at all times. That there are these things that we're like, I need someone else to help me. Just like patients come into me and they say, doctor, help me, I don't know what to do. And actually they have the answer within themselves. And in fact, in a lot of ways, I've seen that they, with just very okay, so the other case study I wanted to talk about is so I had a patient that came in to neurology who was having freezing episodes, and she basically was felt like she was having seizures, but they weren't really like seizures. It would just be, it would feel like she was stuck in her chair.
Hey, Hannah, we're having quite a bit of trouble with the reception and Wi-Fi on your talk. Maybe if you turn down the video or turn it off, the audio will be better and we can continue that way.
Are you talking to me?
Yes, I was just saying that we're having quite a bit of issues with the Wi-Fi. It seems that your video is freezing up quite a bit, and we're losing audio. Maybe if you just turn off the video and continue with audio, it'll be clearer. Let's just try it for a little bit, because yeah, it seems like it's quite spotty unless you have another place that has better Wi-Fi. Yeah, you can try that, but I think it is going to be a sustained Wi-Fi connection issue. So maybe trying with your phone data, or just logging into Zoom on your phone, that could work.
Okay, let me do that. Okay, how's that?
Yep, I think that's way clearer.
Awesome. Okay, so how much did you miss on your end? A lot?
I think we got pieces of most of it. I think we're on track, but yeah.
And then how long do I have? When should I be wrapping up?
I would say that probably another 20 minutes is fine.
Okay,
we're going to set everything back half an hour.
Okay, great. Okay, so I guess I'll just tell you a little bit more about the case study that I wanted to mention, and then bring it from there. So I had a patient that came in, a college student in neurology, when I was in neurology, and she had these freezing episodes that she felt like she couldn't get out of her chair, and her whole body was frozen. And I ended up putting her on seizure medication because she wasn't able to, we couldn't prove whether she had seizures or not, because it might have been such a small seizure, the EEG may have missed it. So I did that, and the episodes went away. The subsequent visits, when she came in, she divulged that she had sexual trauma as a child, that her friend had recently committed suicide. And she was really fascinated by the fact that this, she started thinking, actually, maybe it is psychological, because she asked me, just because the seizure medication made this episodes go away, that doesn't necessarily even mean that it's physical, right? It could still be psychological, and I could be having a placebo effect. And I said, well, yeah, but we did keep her on the medication, and she did go through therapy, and they eventually went away. So for her, it was providing these conditions that, you know, you're in a safe space. We're taking your complaint seriously. We also want to talk about what else is going on. And then she was able to figure out, actually, this doesn't feel quite like a seizure. It feels like it has to do with when I'm really stressed out. And there are ways, other ways that the expectation and the environment can allow basically the unconscious to become conscious in more subtle ways. So this, the concept of placebo also leads me into this idea of expectancy. So and don't worry, this will come back to psychedelics. This is all part of the story. So I wrote a paper a couple of years ago about expectancy and prolonged exposure therapy. So we basically worked with veterans at the VA hospital, and before they went through prolonged exposure therapy for PTSD, we asked them, what are the chances you think this will work? How effective do you think this will be? And lo and behold, the people who expected it to work were more likely to have it work for them. So the explanation a lot of people give for expectancy is that it's a placebo effect, that if you think it's going to work, you're going to try harder and be more engaged. But I would also propose that another thing that could be happening is that we know there are things that we know about ourselves, and that we can actually know about our unconscious memories and our unconscious trauma that is not totally accessible in a way that if you would have asked these people questionnaires about their trauma, they wouldn't necessarily be able to explain. But there's something they know about their trauma, about how ingrained it is and how hard it is going to be to relieve them of those memories and that trauma. So you know, can it be placebo, or could it be just like there are some intuitions that we have about our own unconscious that are not accessible, but that we can access in weird ways. So my feeling is that intuition in a lot of ways is being able to sort of reach into the unconscious and poke around a little bit and have this subtle feeling that maybe I know that this person isn't a good person, or this person isn't somebody I want to be part of my life, or this is if I buy this car, something's going to happen to me. You know, it's like an intuition, that underlying intuition about what things mean to us. So if we're given the right conditions, the intuitions can come out. And I think in a lot of ways, psychedelics are actually providing this space, space to have your intuition safely come out. And sometimes it is even just providing a glimpse for you. It might not be a full flowering of like, I just went through psychoanalysis for years and years and all of my unconscious memories have come out, but that even just this small little glimpse can give you a sense of how you want to be, how you'd like to live your life, who you want to surround yourselves with. And in fact, Nate, my partner, drew he just drew me a little picture about reaching into the unconscious. This is how he interprets it. So I love that. This just happened 10 minutes ago. So reaching into your unconscious and looking around. So there's this concept of a glimpse in certain types of meditation as well. So the type of meditation that I practice is called Dzogchen, and it's thousands of years old. It's in a Tibetan form of meditation. And there are several different types of meditation. There are certain types that are more mindfulness oriented, that you're focusing and you're trying to pull your attention in. And then there's these other kinds that you're actually trying to have an open awareness, and basically the Lama or the teacher, whoever it is that you're with, will say, you know, sometimes it's just staring at the sky for hours on end. And your goal is just to have this open awareness sense. And it feels like a lot of effort for what is very little instruction, often very frustrating to people. But the goal of these meditations is to provide this glimpse, even if it's like a microsecond, that you have this like, whoa, and then it closes and you're not totally sure what you just saw, but it feels like it's something important. And it's a way that you can basically see a glimpse of how you could be relating to the world, and an openness that you didn't even realize was there. And even just that micro glimpse can actually be a driving force for the rest of your life to go find that. Like, that felt more real than anything I've ever done. And I would argue that psychedelics often provide that same thing. It's this glimpse that can open up a world, and then even if it closes when it's done, oftentimes it carries on, but even just the glimpse in itself is extremely important to help someone drive towards getting to a type of truth that may feel more inspiring or more real than the life they're living in. And so I also wanted to mention psychotherapy. So I'm a psychoanalyst, and in the form of psychotherapy that I receive and give, the goal is to have many hours a week. So up to 4 or 5 hours a week, you'll be doing these therapy sessions. And a lot of the more purist psychoanalysts would say you can't speed up therapy, you know, you can try, but it's not real. And my analyst, who's 93 years old now, he was part of the first LSD trials. He was a resident in psychiatry in Philadelphia, and was actually part of those. And he feels like, you know, you can, it doesn't serve the same purpose, but it can help in certain ways. And I would say that that providing this glimpse is as beneficial as some aspects of therapy, and can actually drive it forward faster. And we've seen that with the MDMA studies, that there's a relational aspect that you actually get that you can't get in other ways, or you can't get, it might take years and years to get to that point with trust with the therapist. And it's providing this container to allow some of these unconscious memories to emerge. And even if they don't emerge, there's a way to sort of tunnel into them and just get an idea of what's going on. And I would just say different psychedelics have different qualities that, you know, MDMA therapy can be more beneficial for safety, for relational aspects. Psilocybin, you know, people that take psilocybin sometimes describe that they see auras, and that they can sort of have this intuition about people that they didn't know they had before. And I would argue that that's a way that you're sort of reaching into your unconscious feelings towards that person and manifesting as this intuition about them. And it sort of blows it up into a way that's like hard not to see. So let's see. So Nate is drawing real time some more. Wait, can you explain to me what this is? We're having some art in the background here. This is amplifying intuition, right? Third eye, got it? Yeah, sweet. So if anyone's wondering what that looks like to my partner, Nate Todashek, it's this. I got some more for you. This is the one we just saw, reaching into the unconscious. I've been doing academic presentations for 15 years, and this is the funnest thing. You know, Merrick didn't give me anything I had to talk about, and so I will talk about whatever I want. So this is tending to the garden of the unconscious. It looks a little freaky. I love it. It's still happening. Art is still happening in the background here. Oh, okay, so, yeah, so the megaphone here is, can be, so tarot is an example of a way to amplify your intuition. Also psychedelics, also psychoanalysis, also other healing modalities. I think that it's really interesting. We've been doing a lot of tarot during COVID, and it's like, how is that? How does that help you? And in a lot of ways, it just feels like you're taking your intuition, putting it into a deck, and then reading what you already knew, but in a way that's clearer, putting words to your feelings. What else? So I don't think psychedelics alone are a replacement for therapy. I think in conjunction, they're really great, but also alone, sometimes they can be great as well, because they can create these glimpses. So in summary, intuition can be amplified by psychedelics. And it's sort of intuition is sort of what it feels like to have unconscious bubble up in real time. And sometimes it can be a temporary tunnel, and sometimes it can actually come up and it's just out there. And that's profoundly necessary for healing. And so psychedelics via this intuition and the tunnel into the unconscious can provide a glimpse. And this could be a glimpse that's strong enough to drive you towards that truth forever. In themselves, they can be healing. In MDMA therapy, the traumas can come up, and sometimes the safety, the safety and the environment that psychedelics create in the mind and the therapists create in the room allows certain aspects of your unconscious to come up that may be, for instance, telling you that there's aspects of the trauma that you blame yourself for. And that actually maybe the most important thing is to learn to forgive yourself for how you blame yourself. So that can be really powerful if both of those things are there, that you have the therapist and you have the basically container in your mind. Rewiring memories is also really important, and I think there's a separate mechanism of action of psychedelics that if you're in this safe space with other therapists and people that make you feel safe enough to delve into the aspects of traumas or other memories that feel frightening, that this rewiring can happen, because you're basically creating a corrective experience with someone that's holding you, and then the memory of the trauma becomes less negative because you actually have this, therapist holding the space while this comes up. That's talked a lot about in therapy spaces. What else? Any more art you got? No art, okay. So I think that's all I wanted to say. I just wanted to talk about intuition. I'm excited to see how some of these theories develop. And I think it's a really important thing to think about during COVID and during this crazy experience we're all having that is, I don't know what else to call it other than a psychedelic journey. Or at least a journey that is very similar to psychedelics. We're all isolated and sort of reorienting and viewing things in different ways. So I hope that this is a topic that you all can explore on your own too. And let's see, again, so my organization is SoundMind Project. You can find us at soundmind.center. And we're actually having a solidarity series kickoff event tonight. So from 3 to 7 p.m. we're on Facebook Live, and we're also on Zoom. And we'll be doing some discussion about racial bias and meditation for healing racial trauma. We'll be doing a 1-hour breathwork session and a 1-hour mindfulness session talking about mediumship and grief. And so we have 5 guests tonight. So I would love to see you all there. I'll probably be in the same place for these 5 hours or 4 hours, and please tune in. That's all I got for you. Any questions? I think we have time for questions.
Thanks so much, Hannah. Really appreciate it. Well, first off, the session that you just mentioned, folks are just asking where they can find that. Could you include a link in the chat or?
Oh yeah, I can do that. So all panelists, and I'll go to panelists and attendees. So. Okay, so this is the website, and it's the Solidarity series, so you can find it just going to the homepage. And we're going to be having speakers. Actually, a lot of the speakers are appearing in this conference too that we're having over the next couple months. We'll be doing a lot of different free webinars for wellness.
One of the questions that I wanted to start out with was, you are unique in certain ways in having kind of a more traditional, I guess, education surrounding medical practice, psychotherapy, things like that. I was hoping you could, share what you see, over the next 10, 15 years, the transition from these more standard ways of conducting therapy and addressing mental health to being able to incorporate psychedelics. Is that something that's going to start with the education system? Is the demand going to come from individual practitioners and therapists? Where is this movement going to, I guess, arise from, and how do you see that transition being facilitated?
Yeah, so I think right now there's a very, very strong interest from therapists to get into this work. And it's so after declaring we were starting the center in Philadelphia, I had at least 100 therapists reach out to me and say, like, I want to work with you. Like, how do I do it? And, MAPS has a limited number of people they can enroll. And there's, psilocybin happening probably sooner on the West Coast than here. I think therapists will definitely drive it in a lot of ways because they're the ones seeing that the tools are limited with what they have. And it's really exciting to think about even just something like prolonged exposure therapy, it works, but we have a 40% dropout rate because it's really uncomfortable. And you're asking a person to tell you about their trauma over and over again without any help from medicine. And so as a therapist, it's not very fun to do that. So I think the idea that you could actually help with trauma, and I think a lot of healthcare workers just see trauma everywhere. It's not just neurology, but you know, like a GI specialist will have 25% of their caseload is people coming in with, you know, psychological, physical manifestations of psychological issues. And then they say, go to a psychiatrist, and then the psychiatrist never sees them because they don't feel like it's a psychological thing. So I think anyone in the system is extremely pumped to have new tools. I think patients are very excited too. It's interesting that I think MAPS choosing MDMA as the first psychedelic to roll out makes a lot of sense to me because it's a very trauma-oriented treatment. It works for other things too, but it's like very predictable for how trauma treatment works. And I think that can help people be less frightened of the idea of psychedelics. And Rick Dodlin has also talked about the fact that he feels that MDMA is maybe one of the less frightening of psychedelics for therapists to try themselves. And hopefully there will be FDA approved ways of having therapists receive the psychedelics for themselves so they can lead people through it in a way that comes from personal experience.
Beautiful. One of the questions here from the audience is, could you speak to the role of brain malformation, for example, the Arnold-Chiari malformation and functional neurologic illness and psychedelics? Is there research or resources for this?
Well, so I would say, I would say that there's not a link between like physical malformation and functional illness. A lot of times the physical physical brain issues will go along with trauma, and then the trauma comes out in functional illnesses. So I would someone with treat them separately, and I'll probably like continue to go to neurologists to work on the, you know, the complications that can occur with that. And then if there's underlying trauma or underlying functional illness, then treat that with a therapist. And neurologists also be able to help. A lot of them don't have much interest in the psychological aspects. Some of them do. So find other practitioners. Don't just go to a neurologist is my strongest advice.
And the last question that I had was regarding the MAPS MDMA training that you received. A lot of different entities, individuals are looking to set up training for the space. And I was wondering, what are some of the biggest roadblocks you see to us being able to scale training for clinicians in the space to be able to work with psychedelic assisted therapy?
What are the biggest roadblocks? I guess FDA approval is the biggest roadblock. I think it looks like it will happen, but if that doesn't happen, that will be difficult. I think there are roadblocks, just the infrastructure that needs to be set up. I think having accessibility is a big thing. Even if insurance is accepted for these treatments, they're very time intensive. The FDA wants both. MAPS has been really fighting for having one of the two therapists not have to have education and just have minimal training, and the other person being an MD or PhD, or at least having the other person have not a requirement for like a doctoral degree. And there's been some back and forth about that, but if you really always need to have an MD or PhD sitting in the room for those 8 hours of the MDMA therapy, it makes it a lot more expensive. So I think that's a big barrier to really have accessibility. And even if we get insurance to pay for it, there's still people that are uninsured. And in fact, the people with the highest amounts of trauma are often the ones who are uninsured. I think that's a big challenge. Mm-hmm. Also, just the war on drugs and the history of psychedelics and incarceration of people of color in this country. I think that's a big challenge, just to work through the stigma of something that has been known as a drug to then provide accessible trauma treatment, which is really important.
Mm-hmm. Definitely. Well, Hannah, thank you so much for coming on. Thank you for sharing your insights. We really appreciate the art as well that Nate's created. So thank you.
Thank you.
Yeah, we'll talk to you soon. Be well.
Okay, great. You too.